Deputy Speaker, sir, members of the House, the past 3 years of the COVID-19 pandemic have been a long and arduous journey, fraught with many uncertainties and challenges. The struggles faced by many were heart-wrenching. There were countless difficult decisions and trade-offs made in the fog of war. But right from the start, we had one overriding objective, and that is to protect lives, jobs, as well as livelihoods. We also made a concerted effort to safeguard our migrant workers' health, and thankfully, despite the scale of the outbreak in the dormitories, the mortality rate amongst our migrant workers was very low. There was a paucity of knowledge about the virus regarding its inherent characteristics and transmission modes at the early stage. We did not have a clear, comprehensive, and timely picture of the workers who were sick, because not everyone reported sick. Recognizing the scale of the outbreak in the dorms, the government set up the Interagency Task Force in April 2020, brought in the SAF and the Home Team, as well as public healthcare capabilities. During that period, we worked closely with the dormitory operators, the employers, the medical community, the NGOs, and other community groups to provide care and support for the migrant workers in the dormitories. Vaccination was a key lever in our arsenal in the fight against COVID-19 when it arrived. MON and MOH worked closely together to make vaccinations available to migrant workers from March 2021, at the same time as the rollout for the local community. In less than 6 months, over 9 in 10 migrant workers living in the dormitories were fully vaccinated. Looking back at the way we contained and managed the outbreak in the dormitories, we asked ourselves, could we have done things differently? If all of you recall, at the start, testing capacities were very limited. But I think we could have done more. We could have done more surveillance through sample testing for the different migrant worker population to detect clusters early. Masks were very scarce at the start, but we could have ensured some form of facial covering, protective covering, or some form of mask were worn by migrant workers to reduce the incidence of transmissions. Distilling lessons from the pandemic, we have made permanent structural reforms in our migrant worker management capabilities and the ecosystem of support for the local workforce, so as to institutionalize lasting change. Care for our migrant workers has been reinforced in 3 ways. 1, we've improved standards for migrant worker dormitories, and we will be expanding the coverage of feeder. Secondly, we have set up a new primary healthcare systems and the primary care plan for migrant workers. Third, we have better capabilities to improve migrant worker mental health with Project Dawn. COVID-19 indeed fell on us like a heavy storm. But together, we have weathered the worst, and we were able to build back stronger. While we are yet to reach journey's end, we have indeed come through the storm together.